Disclaimer: the videos presented on Rare Disease Roundup are intended for informational and educational purposes. They are not intended to substitute for professional medical advice, diagnosis, and/or treatment. Please consult your medical professional before changing your diet, exercise routine, medical regimen, lifestyle, and/or mental health care. The videos presented on our YouTube channel are not meant as a diagnostic tool. If you or anyone you know is experiencing symptoms similar to those described in our videos, please seek professional medical advice as soon as possible.
Prader-Willi Syndrome, or PWS for short, is a rare genetic disorder that impacts many parts of the body, including physical growth, intellectual development, behavior, and mood. It is the primary genetic cause of life-threatening obesity in children. PWS is caused by genetic changes in chromosome 15 that affects how genes turn on and off. Symptoms in newborns include poor feeding, weak muscles, and slow development. Beginning in childhood, those with PWS become constantly hungry. This often leads to obesity and type 2 diabetes. Because of low muscle tone, a PWS sufferer needs less calories than a typical person. The extra calories they consume are rapidly stored as fat. There is a strong relationship between failure to thrive babies and this genetic predisposition. This is the currently known mechanism for a person developing PWS, and both factors need to be present for Prader-Willi to develop. PWS symptoms vary in severity and occurrence, but some related conditions include obesity complications, such as cardiovascular disease, non-alcoholic fatty liver disease, diabetes, sleep apnea, and respiratory failure. A common symptom of PWS is a lack of gag reflex. As such, a person with PWS is physically unable to vomit. This is especially dangerous if the person with PWS binge eats. Several people with PWS have died due to their stomachs bursting from overeating. Not to mention that the PWS sufferer, in an attempt to satisfy their hunger, is also more likely to choke while they eat quickly. People with PWS can also have cognitive challenges, such as low normal IQ to moderate intellectual disability, learning disabilities, and OCD-like symptoms. PWS affects 1 in 10,000 to 30,000 people worldwide. It occurs in both males and females equally and occurs in all races and ethnicities. PWS is a difficult condition to live with because those suffering from it feel constant, unrelenting hunger. This causes an obsession with food that overshadows all other aspects of life. As such, people with PWS cannot live independently. They need the supervision of a caregiver to regulate their diet, restrict access to food, and be present while the person with PWS is eating. To learn more about Prader-Willi Syndrome, the National Organization for Rare Diseases has a page on PWS in its rare disease database. If you've enjoyed this video, please like and subscribe to our channel, and if there is a rare disease you'd like to learn more about, please let us know in the comments. Thanks for watching, see you next time.